South Sudan is a country of 644,000 kilometers square. Our population is 11.5 million. If you compare it to Europe, you need to put German, to add Greece, you add Ireland plus Portugal. All this, when you sum up their square, they will come closer to the kilometers of South Sudan.
I came to South Sudan in 2014, right after the civil war who took place in 2013. The backload of people who are suffering from eye diseases or for blindness, it's very high due to the political situation and the lack of ophthalmologists in the country.
The partners we're working with in South Sudan is a Catholic charity called the Catholic Diocese of Wau. Wau is a town in the northwest of the country, and they're very active there in providing a lot of healthcare for the population, but specifically eye care and specifically cataract surgery.
The partner that we chose to work with there, we got a very good impression. They applied for funding from us, and they've been in that area for a very long time. So they're not flashing in, they're not flashing out. It seemed to us to be a trustworthy, really stable, long-term partner in an area that has a unique set of challenges.
South Sudan is divided in 3 regions. We have Bahr el Ghazal region, Upper Nile region, and Equatorial region. We discovered that actually Greater Bahr el Ghazal has the biggest burden of blindness in South Sudan. Our number as ophthalmologists is so small. And so for us to create satellite facilities to give services become a challenge.
There are only 6 ophthalmologists in the whole country who are active, and they all are based in the capital, Juba. So if we need an ophthalmologist, we always rely that people from Juba are coming to Wau. This is even that people who are blind have sometimes to wait for more than 1 year that they get treated.
Wau is the biggest town in Bahr el Ghazal. In Wevill, which is one of the main area where we do our cataract eye camps, the infrastructure are not well developed, and assessing it, you need to travel 5 hours. Some of them have to travel 3 days.
The particular person we're working with is Professor Kenneth Lado, who has previously been president of various societies in the country and is a professor at the university. And he supervises and manages these projects because, for instance, in a cataract surgical camp where they go out to a community to look for cataract patients, they find a lot of pathology. So they will screen at a cataract surgical camp up to 13,000 people. They will find 2,000 cataracts, and they will operate on 2,000 cataracts over a 3-week period. And that takes a lot of management, and he's been great at putting that together and achieving a great impact through managing the funds and the resources very well.
Doctors in the field, it comes down to a doctor in the field. The project that he's running for us, he's covering a huge area. There's one ophthalmic surgeon, and he's got well over 1 million people in the area, and that's increasing because there are now quite a lot of refugees coming in from Sudan, and the amount of work that he carries out over there is really quite remarkable. In fact, I don't think there's anything comparable anywhere in any of the other areas that I've worked in terms of what he's doing. And a lot of those people particularly vulnerable.
There are barriers to accessing healthcare in poor countries. One of the big barriers is education, just to let people know that they don't have to put up with being blind. Another barrier is access to the healthcare. It's better to take the care to them rather than asking them to travel a long way. And also the cost. To try and provide the care at the minimum cost or at no cost is really, really important, because a lot of people in these poor countries like South Sudan are paying out of pocket for the expenses. And when that out of pocket expense is competing with food and education for their children, then healthcare is often low on the priority list. And that's where we step in and we try to subsidize the care so they can access it.
We succeeded to give better service through the Catholic Diocese of Wau, who are deeply rooted within the community. So mobilization of people in that community becomes easier. and they are friendly. And when they saw that we were restoring their sight, they become very excited. And the more the outcomes we do, the more they turn up. But the beauty of it is that once you do the cataract and they see, they start to appreciate. Once it's done, they go back to the life.